Hello, good evening, everyone, and welcome to our mental health webinar on love, intimacy, and cancer. So, it's all about nurturing emotional bonds during treatment. So, as many of you are aware, cancer is not just a physical journey, it's affect every aspect of life, including emotion, relationships, and intimacy. So, for many patients and their partners, uh, we would like to say that navigating love and connection during treatment can be very challenging with concern about their body image, physical challenges, and emotional distances. So, however, intimacy and emotional support, we guess it's like plays an important and crucial role in healing, providing comfort, strength, and sense of togetherness in the difficult time. So I'm Malini Rama, a registered counselor with will discuss the emotional and psychological aspect of love, intimacy, offering guidance and communication, and also emotional bonding and recovering stigma. So with us later, we will have we are honored to have Dr. Nur Fadlina Abdul Sattar, consultant clinical oncologist from Pantai Hospital. So she will share expert insight on how chemotherapy, radiotherapy, and surgery affect intimacy as well as medical advice for managing these challenges. So we will have this session with Dr. Fazlina later. For now, let me do some sharing from my side. Okay. Okay. So for today's session, what the participant can gain is, of course, we will discuss and we'll discover why love and companionship are essential in the cancer journey for both patients and also for caregiver. Okay, so we also will explore the power of affection, touch, and emotional bonding as key elements of intimacy beyond physical connection. Okay, beyond physical connection. Okay, and also gain insight from our beautiful clinical oncologist on how chemotherapy, radiation, and surgery impact sexual health, hormones, and also emotional well being. And last but not least, learn about common physical changes during treatment and how to manage them effectively. Okay, so is everyone ready for today's session? Yes, let's go. So before I jump into today's topic, it's about intimacy, about love, about the cancer journey. I wanted to do a quick mental health check-in. Of course, as a counselor, I need to do this with all of you. For those who are watching us today, so please feel free to answer this. It's all about you. And how are you doing today? Feeling good? Really? How are you doing physically and mentally? Okay. Answer honestly. Okay. Okay. So what's taking up most of your head space right now? Anything worries you? Are you Is anything bothering you at this time? Okay. So can remember how was your last full meal? And have you been drinking enough water? Okay. So we leave that two questions for you to answer by yourself. Have you been sleeping? How have you been sleeping? Do you get a good sleep, deep sleep? And also, what's something you can do today that will be great for you, especially before you go to your bed? Okay. So let's start. So let me just give an introduction about support services at NCSM. Of course, as a counselor, and beside providing counseling and emotional support, counseling services to our patient, we also have other support services at NCSM. We do have cancer information service. We have guided patient support. We have counseling and psychotherapy. By counselors and also our clinical psychologists. We have dietetics, we have play therapy and child psychology, and we do provide peer support. Okay, and also we have group support as well, and we do have home of hope. So feel free to take down our contact number our helpline in case you have any question or you feel you wanted to talk to our mental health professional or you wanted to talk to our in-house doctors. So feel free to contact us at 1800 881 1000. So the first one is, of course, all about the role of love and emotional support in the cancer journey. I guess like today's topic is very close to me because for the past few years, I've been working closely with couples. I've been working closely with caregivers. I've been providing a lot of relationship counseling and also marriage counseling. So for today's session, I guess like it is something that I've been wanted to talk about it for some time, and I got the opportunity today. So the role of love and emotional support in the cancer journey. First one, let me explain what is all about emotional support. Okay, doesn't matter if you are married, if you are not married, you have a family, friends, and everyone. I mean, when it's come to emotional support, it's always about comfort, reassurance, and encouragement provided by the loved one. I guess like the first question that I will ask during my session when we do the initial session to get to know the patient, we will always ask them about their support system. So because the support system will help them provided by the loved one, helping patient cope with fear, anxiety, and uncertainty. Okay, this is 100% true because when a patient have a good support system, their journey will be different. Okay, so emotional support also includes listening. Someone will be able to listen to you, being present to you, offering encouragement, and providing physical affection like hugs and holding hand. So emotional support can be provided by anyone. It doesn't mean that only your spouse, only your husband. Only, it can be a friend, it can be your colleague, it can be your family members, it can be your siblings, it can be anyone. Okay, so why we wanted to make sure for today's topic, why love and support matter in the cancer treatment? Of course, the first one, it helps to reduce stress and anxiety. Why we like to say that? Patient with strong support system handle treatment better and experience lower emotional distress. Also, when we like to talk about boost resilience, okay, we always say that it's about feeling loved, increases motivation to go through treatment. I guess many of you will agree on this. And the third one, it prevents isolation. Why we wanted to say it prevents isolation? Many patients always feel lonely. Having a partner or friend or family members who understands them reduces emotional withdrawal. Okay, and there is a study by the National Cancer Institute 2022 found that cancer patients with emotional support shows better coping mechanism and treatment adherence. Okay, so yes, so the next one will be all about navigating relationship challenges during the cancer journey. Okay, so common relationship struggles during cancer treatment. Okay, I'm sure many of you will agree with me. The first one is the role shift. Why I say it's the role shift? Because the partner may take on a caregiver role, your partner. Okay, so you might be the patient and your partner might take on the caregiver role and leading to stress and frustration. At NCSM, as much we give importance to the cancer patient, we give the equal importance to the caregivers as well because we understand the caregiver's dilemma. Okay, so second one is the emotional distancing. The patient might withdraw due to sadness, guilt, and self-esteem issue. Okay, so they will keep their distance on this. The third one is the communication barriers. Why we like to say this? Because many will avoid conversation due to fear of burdening their partner. So they always find that they are giving burden, they are giving trouble to their beloved one. So these are the communication barriers that many will face. So common, now it's the common emotional struggles. The first one is of course, is the frustration. Okay, so the caregiver may struggle with balancing their responsibilities. Okay, second one, fear of rejection. Many of our patients, based on my experience also, they are worried their partner will see them differently. Especially if a patient diagnosed with breast cancer, they have to do mastectomy, removal of their breast, and they will find that something is going to lack into their marriage because their partner might look at them in a different way. So the love is going to be reduced, the intimacy is not going to be there. So they start to worry about it. And the guilt and helpless, another one, the patient may feel like a burden, as we discussed earlier. Okay, and there is a study in the journal also emphasized that found that open communications helps couples manage stress better during their treatment. Okay, so before I go to the next slide. So if you look at this particular in the yellow color one, overcoming these challenges is also we encourage open conversations. Okay, we always encourage the patient and their partner to have some deep conversation. Okay, the moment they have this open conversation, they will try to know what is lacking and what to improvise in their relationship, and also acknowledge and validate the emotion. I guess like many of you will agree that as a person, we can't be positive all the time. 24 hours we cannot be positive. We are allowed to express, and we are allowed to have all kind of emotion, sad, angry, frustration, and all that, as long it did not interrupt our daily life. So in that case, like the partner maybe can tell them it's okay for you to feel worried, it's okay for you to feel sad, take your time. Okay, and also setting boundaries in caregiving is very important. Okay, so practical strategies, we'll go to the practical strategies. So yes, let's come to this topic. So it's kind of I won't say it's a sensitive topic and all that, but many will refuse to talk about this. Okay, but I just wanted to do a quick introduction about this, what is intimacy is all about. Intimacy is about feeling close, safe, and connected. Many people, they have this mindset that intimacy is only about physical touch. No, intimacy, it's about how are you connecting yourself with your beloved one. Okay, how are you feeling close with them? Do you feel safe? Do you feel secure? Do you feel happy whenever your beloved one follow you to your for your follow up in the clinic, just sit with you during your treatment? How do you feel about it? So it's not only about physical touch, it's about someone being there for you and you are deeply connected to them. So it can be also holding hands, expressing appreciation, and maybe like you can writing a love letter, or many will agree with me, it's about spending quality time. Okay, so ways to stay connected during cancer treatment: non-sexual affection. Okay, I don't want to speak about sexual affection for now because we will ask this about this with doctor. So non-sexual affection is all about holding hands, hugs, resting together. Okay, so power of word also very important, especially words of affirmation, regularly expressing love and appreciation. The more you say that you love your husband, you love your spouse, you can feel like how beautiful it is. Same goes to that person. Okay, so appreciate them. Okay, you can just use simple word to say good night, uh, you know, take care, all will be well, I'll be there with you. So words have so much of power in the healing process. Okay, and the third one is the quality time. Okay, I met a patient today as well, like when the patient and the spouse are there in the hospital. Okay, I could feel how the patient feels so happy when her husband was around, and she was proudly talk about her husband, like to say the support given by the husband the moment she had been diagnosed with cancer until today. You know, the husband used to be with her, follow her for the follow up, just sit next to her, wrap her with the blanket, just help her to wear the socks. So it's so nice to see and to listen when the patient feels so happy when their spouses are around during the treatment or during their cancer journey. Okay, so quality time is also about watching movies, okay, recalling back all the love memories, old memories, spiritual bonding. And what I would like to say is about the low energy bonding activity. If you are in a um, active treatment, you feel like you are very tired, you are very drained with the treatment, with the medication, with the side effect. It's not necessary for you to spend so much of time or to do so many activities together. So low energy bonding activities is basically to listen to music together, just sit, talk about something. A few words is good enough. You can read book together, you can talk about something spiritually, you can talk about your family members, you can talk about your neighbor, you can talk about someone. So low energy use a simple activity that at least you spend about 5 to 10 minutes with your loved one. Okay, so let's go into the breaking stigma and encouraging open conversation. So before we go to, we introduce Dr. Nina later. So here, so why patient hesitate to discuss about intimacy? So we will ask this question to Dr. Nina later. Okay, and why is talking about intimacy during cancer still a taboo? People find it like, I don't want to talk about it. uh, Maybe it's not important for me to speak about it because I'm undergoing treatment. So what will people think if I start to look into this matter? Okay, so some believe it's selfish to think about love and intimacy during cancer. Okay, is maybe some of you will agree. Okay, because they find it like it's selfish. Okay, I'm undergoing treatment, so much of medications, I'm facing a lot of side effect. Why it is intimacy and love is so important, I don't need to talk about it. Okay, because they do believe in this. Okay, fear of judgment, many avoid discussing intimacy with doctor and partners. So this one also we will discuss with doctor. Okay, how frequent she received those cases, like a patient discuss with her about this. And some people feel shame and embarrassment discussing intimacy after diagnosis. For them, it is not important at all. Do not talk about it. Okay. So also cultural belief, many and this encourage open discussion about sexual health. Okay. So why these conversations are important? As much people still have the taboo, people hesitate to talk about intimacy. Why we feel as a mental health professional, we find it is very important this type of a conversation, because we find it patient or often avoid asking doctor about side effect of the treatment, leading to confusion and distress. Okay, so addressing intimacy concern can strengthen relationship and emotional bond. Okay, so we find it these two are the important one, why the conversations are need to play an important place into the relationship. So how to avoid stigma? Okay, so first one, maybe we can say that we always encourage the patient and their partner to have an open conversation about emotion, about desires and fear, especially young couple. Okay, for I guess, like from my experience, I always have this marriage related issues or relationship counseling, um, for young couple, many. Okay, because they find it this intimacy and sexual health is important during their cancer journey. Okay, so we will ask about this with doctor later. And we would like to also say that to overcome the stigma, we have to normalize discussing physical and emotional changes. Okay, so how to start the conversation? Normalize discussion, okay, by creating safe space. You can always create a safe place for both partners for you to share the feeling. Okay, and also maybe you can start use statement like, uh, I have noticed changes in our intimacy. Talk openly, because end of the day that person is your spouse. Okay, so whatever bothering you, whatever concerning you, it's time for you to talk about it. Okay, so you can see that you have noticed changes, okay, in our intimacy. How do you feel about it? Okay, and maybe you can always say, I still love you the same, and I wanted to support you. Okay, so uh, in case you still have confusion about this, how to open about this conversation about intimacy, you can always look for professional support. Definitely couple counseling may help. You can speak about it to your doctor, and talking about doctor related is very important. So so without any delay, we'd like to invite our beautiful, charming doctor, Dr. Fadlina. Okay, is she here? Okay, Dr. Fadlina is currently a consultant clinical oncologist and at Pantai Hospital, Kuala Lumpur. Okay, so Dr. Nina, hello. Happy Tuesday. Good evening, doctor.
Hi, Malini. Thank you for having me.
Okay, would you like to share with us about your role and maybe uh, what you are doing? I mean, of course, you are seeing a patient, so maybe your role in hospital as
Sure,
a
Malini.
consultant clinical. Yeah.
Yeah, I see patients with cancer
Mm-hmm.
and I treat them with drug treatment, be it targeted therapy, chemotherapy, or immunotherapy, and also with radiotherapy. So that's X ray or treatment in terms of treating patients with multiple different types of adult malignancies. So breast cancer, head and neck cancer, bowel cancer, to name a few. So I work closely with a lot of other doctors in my hospital because
Okay.
clearly, and not just doctors, a lot of healthcare professionals, chemo nurses,
Hmm.
speech therapists, physiotherapists. So there are lots of different people that are really important through the patient journey. And clearly, someone like you, Malini, who have been really actually instrumental in patients with cancer. And I'm so glad that we have had the chance to meet.
Thank you so much, doctor. So nice of you. Okay, maybe for today's topic, maybe I can just check with you or ask you. Um, Maybe about this treatment. Okay, how do common like cancer treatment basically, I'm sure many of our uh, viewers, they have this question into them, like how do common cancer treatments such as chemotherapy, radiation and surgery affect a patient punya intimacy and also sexual health, in your opinion, maybe based on your experience?
Right, Malini. So clearly, there are so many different factors that can affect a patient's journey. Um, and different cancers can affect someone differently. So just having the word cancer thrown into your life completely puts a different perspective or different lens into how you see your life, because clearly no one has cancer in their agenda, right? But similarly, I feel that you can view the word cancer also as a way of viewing things or changing things, right?
Hmm.
It is another way. So let's say you've been doing something in a certain way and then you've been given this challenge, and then you're thinking, okay, I'm going to reset a couple of things, for example. But as a whole, it is a stressor in your life. So it puts a significant stress, not just in how you regulate
Mm-hmm.
yourself, but also it will affect how you would be in terms of communication with your spouse, your colleague, your friends, your family. So it will put a lot of strains in relationship for sure.
Mm-hmm.
And specifically, if you're talking about um, intimacy, meaning um, if your communication wasn't open before this, and
Yeah,
then you have another challenge, then that
exactly
communication
correct.
going to be further of a challenge
Ah,
for you, and then clearly that can affect you significantly. I'm not taking lightly the fact that, radiotherapy, for example, if you have um, cervical cancer, you
mm,
treat it with radiotherapy, that can cause issues in terms of sexual
mm,
health. Absolutely. Not just in women. So if you have rectal cancer, for example, and you've got
okay.
radiotherapy, or prostate cancer, that can affect men in terms of their sexual health. But I
Mm-hmm.
just feel the word cancer itself as a whole can put a lot of strain in terms of relationship and then in terms of intimacy.
Okay. When you mention about vaginal cancer and all that, okay, I do encounter like a patient who also like complain, not to say complain, they try to share with me to say that um, they experience like vaginal dryness, okay, erectional dysfunction, and loss of libido due to treatment. Like, what kind of intervention or maybe like treatment? Was there any treatment that available uh, to help them regain back their intimacy? Because it could be part of their side effect, right?
Yeah, for sure. So I think, Malini, what we're touching upon is something that's physical, right? So
Mm,
actually, the truth is, as doctors, sometimes when we are rushing through our consult, we miss out on asking very important questions like that, right? But I feel that I do want to give permission to us, as even as patients, to be able to say, hang on a minute, I do need to be asking these questions if those are the issues that I'm having. um,
ah,
right, I mean, I think it's a conversation starter. Let's talk openly
mm,
about it. So the way that I have come to it is to ask my patients. So I see a lot of breast cancer patients, and I just ask them how things are getting on in terms of their sexual function. And it's as a matter of fact, and it's part of your health, so it needs to be conversed about. Um, Whereas in terms of treatment, you talked about vaginal dryness. Clearly, there are lubricants that's available. And not just that, if there are issues, then we can refer to our gynae
mm,
colleagues to review. Clearly, there are, you know, some patients who have hormone positive breast cancer, for example. We try not to use the estrogen vaginal gel,
okay.
but if you don't have hormone positive breast cancer, then that could be an option for you. So those are the things that you do want to discuss with your oncologist, and your gynae more about what's available. In terms of for men, if they do have erectile dysfunction, then that would mean that we would have to refer them to urologist, for them
Ah,
to be reviewed, to discuss what options they have. So I think the most important thing, the gatekeeper here, is not having conversation. When you don't have that
correct,
conversation,
yeah.
open up all the available avenues of possible treatments.
Correct. So, like, based on your experience, like, how frequent, like, patient asking doctor about their most probably sexual side effect of the treatment? Do they like? Of course, they will always ask about the side effect of the treatment, but do they like come and talk to you or ask you about the side effect, like macam sexual punya side effect, particularly about it, like intimacy, health, sexual health punya concern. So, how
So
frequent?
infrequently,
Hmm.
less frequently than you would expect. And I think that's because um, when the word cancer is being thrown at you, you are just thinking fight or flight. Your sympathetic nervous system goes up, and you're just thinking survivor mode. So when you're in survivor mode, you're not relaxed and regulated to be thinking about other aspects of life. But once you've done your treatment, then conversation starts happening if there are issues. Um, to be honest, I find clearly if we're talking specifically, it depends on the type of cancer that you're talking about. So, for example, if you're talking about prostate cancer, then clearly you would have to discuss that as side effects before
Mm,
radiotherapy, for example. So, that is a conversation starter. So, they would then start discussing about that. But yeah, when you're on a journey, there are different priorities at that point in time. So uh, I guess today's session is really to say we need more conversations and to give permission to be able to talk about it more. But Malini, I would like to bring it back to say that intimacy is not just about sexual function or health.
mhm,
It also, as we discussed before, it also goes deeper than that in terms of how do you feel connected emotionally, psychologically
mm,
supported, for example.
mm. Okay. So during the patient's visit to come to your clinic and all that, so how do you find that it is very important for their spouse to come along to discuss about the treatment, about the side effect? So how in your experience, how you find it like?
So not just spouse, I feel that having someone there
Uh,
uh, is very important as another support,
mhm,
another pair of ears, um, another note taker, so that you can cross check that you've heard the conversation right or what the doctor said. I feel that it is very, very important to have someone in the room, and if possible someone consistent, if there is that ability to have
mhm,
someone consistent, and just to know that you're going through it with another person would definitely help a lot. So
yeah.
when and if my patients come in alone, I tend to sort of ask, do you have another significant other who you, or a relative, a family, a friend who you would want to bring in with you for next consult? I mean, it doesn't happen every single time, but sometimes it does.
Okay. Okay. I guess like many will agree that patient hesitate to discuss about, of course, again come back to this topic, discuss about sexual health consent with their doctor due to embarrassment and cultural barrier. So how can they start this conversation with their healthcare provider?
Okay. Um,
Do you think there is still a taboo? The stigma is still there.
for sure, Malini. If not, then we wouldn't be having this session today at all. Um, but I think it starts with the ability to voice your concerns. So I think now more so we are no longer in paternalistic medicine where you go in and you're expected to be told what to do and then you go out again. So we try and build a partnership. So when my patient comes in, we think about a shared decision making, so a discussion, understanding each other. So that process is really more of forming a relationship. So once you have a relationship with someone, then you'd be surprised at how much a patient would be happy to share with you their concerns and they feel cared for. So I feel that as patient, I encourage you to be empowered to be asking these questions because they are valid and there are experts out there that can help you.
Okay, totally agree with you. So anything like you have yeah, your any special case that they come along with so much of confusion, to say that uh, uh, you know what will be like some common safe intimacy practices that they would like to know. Is there anything that the patient used to ask you?
Um, I think
Because they
I
always have the fear, right, doctor, like because they just don't want to give importance to this part. But when we see overall, the support, the love, the intimacy is very important during, not only during the treatment but also during the cancer journey. So How you find it, like, again, the patient are talking about it, and they find it whether it is safe or not. Do they come and ask you anything?
Okay,
Not the
so
patient, maybe the partner or spouse.
I see. Okay. So, I mean, these are clearly cancer survivorship issues, right,
Mm.
Malini? An important aspect of cancer survivorship. And I want to share with you an experience where we did Malaysian Breast Cancer Summit 2024 in Penang. And one of the topic that we talked about during that session was sort of about sexual health and intimacy for breast cancer patients. And during that uh, session, so it was a live session, I was really encouraged to see that there were many patient survivors who stayed back afterwards to discuss more or share experience. And also, it was heartwarming to see that they were couples. So really clearly, this summit was for ladies with breast cancer mostly. That's like majority of our participants, but we also had husbands who
Huh.
came with the partners, and then they really sort of shared how they learned through the experience, and also how they don't feel so alone as a couple
Hmm.
through the journey. So that's number one. I mean, another one is, I feel that, more mature ladies would be more open to sharing this, in terms of sexual health, and they would say, oh, it's a need now. And sometimes you just look at the public holiday and then calendar it that way, to get it going. For example, if you're looking into scheduling, so those are real life stories out there of
Ah.
people sharing. But I think in our society as well, there might also be harsh comments, for example, sort of lots of judgments in terms of, okay, for example, you've had breast cancer, and then, what about your fertility? How would that affect you? And how would that
Hmm.
affect you and your partner? So there's definitely that going around as well. I'm just going to leave breast cancer for a moment and go to thyroid cancer, because I see a lot of patients with thyroid cancer
Yes.
who would need radioactive iodine. So
Ah.
radioactive iodine makes you radioactive at a certain dose level. And so for those patients, I would tell them that it's important that they use barrier precaution for sexual precaution to prevent them from getting pregnant sort of 6 months after the treatment. So for those conversations, I ensure that my patient have their partners with them, because,
Ah.
right, because it's not just like, I'm not just telling, it's not fair to have that conversation just with one person. I feel that it needs to have, like, both of them needs to be responsible for this, because I have seen patients who've had, unfortunately, um, became pregnant, unfortunately, right? So we do take this seriously in terms of precaution. So that's for radioactive iodine. Clearly, not all cancer patients require this level of precaution in terms of being safe.
Okay. When you explain to them, like, in advance, like they need at least 6 months precaution, like in terms of their sexual health and all that. So, what will be their reaction, or do they tend to ask you anything more about it, or do they just like agree? Do they have any question to ask?
So the main reason, I mean, for radioactive iodine, it's fairly straightforward.
Mhm.
The main reason is because of the effect that it can have on the fetus. um, right, so in terms
Correct.
of in terms of issues in the fetus. So and that is uh, a valid enough reason, I feel, for the partner, and they would completely understand that. And then we go on to support them and say, we can make an appointment with gynae in terms of contraception discussions if needed. So there's always a follow-up with regards to that. So I don't feel that the conversations that I've had before, I don't feel that it was met with resistance as such, but I'm sensitive that I do need both partners in so that they are both responsible for it. Um, but definitely, when ladies have got cancer, clearly there is um, a further burden, I think, that we don't talk about in terms of feeling the inability to fulfill that role.
Yeah, correct. Like, wait, okay, I continue with the one that you discussed just now. I guess like the body image and the self esteem also plays an important role, because maybe for the ladies, for the women, they always find that, especially breast cancer and all that, they find that, they are losing their asset, especially after mastectomy, and also when they find it like, the scar, hair loss and all that. So maybe, like, in your opinion, how you find it that this body image and self-esteem is important role into this relationship or marriage, like how they can detect.
Oh, it's a huge issue for sure,
Mm-hmm.
because number one, in terms of losing one's hair, um, and then in terms of scarring. But I feel that nowadays we have lots of surgical techniques from our skillful breast surgeon in terms of how to perform surgery or lumpectomy with good cosmetic outcomes. So clearly we are moving forward. So we try and preserve the breast as much as we can and reduce mastectomy if we can help it. But certainly, in some ladies, you do see how it affects them significantly, and the role that they play in their lives. And really, the way to overcome that is to discuss openly about how they feel. Have someone like you, Malini, a counselor, or speak to a psychologist, right, in terms of how that is affecting them. Number one is to admit and to be aware that it is affecting you in such a manner, and then looking for support and actually having um, other people going through similar treatment and similar feeling helps tremendously. So hence I've been singing praises of NCSM and like referring lots of my patients to you to ensure that they have that group support. Although like lots
Right.
of patients say, they have family, but the family is not going through the treatment, not going through what they're going through. So having
Right.
another person going through the same treatment and experience and sharing actually just opens up another viewpoint for sure.
So in NCSM, we do have this couple session that, we used to organize. It's a group session. Just we invite the couple, the patient and their partner, to do their
Right.
sharing, and sometimes we allow them to share their experience, share the tips and all that. So I just like wanted to highlight on this. Okay. So next one. Yes, when one more thing that I would like to share here, doctor, it's like my experience recently also. um, I do have a patient who came, and due to marriage and relationship issues, but when I explore further and all that, basically they ended up in a divorce just after a month or 1.5 month after marriage, because the wife, which is the patient, not able to satisfy their spouse and partner, even though before they got married, they have been very transparent. The patient has been discussed about the diagnosis and all that. She already in the survivorship, but then again, intimacy or sexual health is like something like very important in the marriage, and also it can lead to unnecessary decision. Okay, so in your, maybe just in your opinion, do you think like in marriage, marriage and how to say, how frequent like you see a patient that comes with the concern that after I've been diagnosed, will this lead to uh, marriage punya issue ke, or breakdown in the marriage, because the
Definitely.
self esteem.
Yeah, I mean, I think Malini, definitely in the community,
Yeah.
we hear stories that you've shared today frequently, unfortunately. Um,
Yeah.
I myself, when I'm treating my patients, have not encountered a lot of sort of marital breakdown post diagnosis.
Mm.
But it's definitely a known phenomenon that happens, that comes with the cancer diagnosis, because I mean, I'm not sure it's tied down specifically to the role of the wife specifically, but I think it just opens up a lot of other issues in terms of relationship stress, and other issues that can cause
Yeah.
a breakdown in a relationship. So I don't think it's an isolated incident. And um, certainly also conversely, I have witnessed, once a patient, I have witnessed where patient who's got cancer, and for example, they're given a short period of time, in terms of poor prognosis. I have seen that as an ultimate show of love, patients do get married during that time. So I guess there are differences or different viewpoints on how we view relationship, as such.
Okay, thank you so much, Doctor, to answer all the questions and your opinion and really matter here. And so, is there any question that from the audience or participant for today? Okay, I guess like, huh. Okay, hi Malini. How do you suggest handling feelings of guilt and resentment that arise when one partner become caregivers? Okay,
So
how do you?
I'm glad, Malini, that you got this question. Thank you. I don't think it's an easy question, but it's an important one, right? In terms of when you're burdened with the caregiver responsibility, um and then you're like, oh, I didn't sign up for this. And or maybe there are issues that come with it, and then when you don't have open often open talks or check-in or communication, then it just sort of builds up and builds up, right?
Correct.
And that
Like
resentment.
you mentioned earlier, some they might come like they already have the issue with their communication much earlier. So when they come, during the treatment to seek the opinion, so it's already like piled up. So it's very difficult for them to open up and talk about it. So in managing about the feeling of guilt and resentment, I guess like as a caregiver, it's very important the communication. I guess you have to sit and you have to talk with your beloved one. Okay, so definitely the guilt will be there because your role as a caregiver, it's not going to be a normal role. Because for example, your role as a husband, your role as a father, your role as a son for someone, at the same time you are taking care of your beloved one. Okay, so most probably you are in a guilt to say that, am I providing the enough care and support to my spouse? Okay, so in this way it's very important for you to sit and talk and maybe allocate time, the quality time with your beloved one. So this will be very easy. If you have more doubt, you feel that you doesn't know where to start with, you can always give us a call and we can guide you.
But also, Malini, I find that it's important, as a caregiver, to also think that you need care as a caregiver, self-care, right? And to
You
have
can't pour from the empty cup.
you can't, right? And to
Yes,
have
you can.
and to have that boundary and say, okay, I know first I have to look after myself, and one part of looking after myself is to have open communication if you are feeling that there are trigger points, right, that will come up, and then have open honest conversation. And you can't control another um, person, right? So
You're right.
it right. So there are a lot of things that are out of your control. I think to understand that as well.
The guilt also will appear when they find it that it is not important for them to of course it's about self-love, but for them to like have the social connection, to go out, to spend time with someone, to have that little me time also, they will feel guilt, so much of guilt, because they find that 100% priority need to be given to the beloved
Right.
one. So
Right.
please don't feel that, because you got all the rights to have your time, because that's what doctors say, and from my opinion also, when you can have your love, you love yourself, you have enough, then you'll be able to provide to your spouse or for your beloved one.
Permission granted.
Okay, so anything, next question. Jeffrey Lee, can physical intimacy between cancer couples be totally disrupted and ceased? Uh, do you have any opinion about this, doctor? Can
So
intimacy?
I guess this question comes about from, I'm going to take it first from the medical point of view.
Mm, mm,
So the only times I'm thinking is during, for example, just now when we spoke about one of it, radioactive iodine, you're having the treatment and you're confined in the hospital. So clearly no physical intimacy is going to happen there.
mm, mm,
And then when you're talking about, for example, if you've got surgeries, and clearly you need time to recover from surgeries. But I feel so. So that is sort of using the medical vehicle, but I feel that we need to sort of look at it from a different angle. So a different angle is to look at why isn't there the want of physical
mm.
intimacy? And perhaps that's because there's no connectedness between both in a couple. And if so there is and what's the cause of no emotional intimacy or connectedness? And then
Yeah.
so there need to be work done there before it can then perhaps lead to more physical intimacy. So um, if, for example, um, you know, a patient that's going through their cancer journey and is really troubled by it, anxiety, depressed, mental health issues, clearly that would impact their
Mm.
communication, right, Malini? And then that can
Actually, yeah.
on their physical intimacy. So that's the
Correct.
way that I can see where this is coming from.
Mm. Like as I explained much earlier with my few slide, I already say that intimacy is not only about physical touch. It's more about the deeper connection that someone can have with their spouse and with their loved one. The more you have that deeper um, connection, automatically you can go into the deep conversation and all that. That is where you can tackle into the physical intimacy part. Okay, so let's have the basic one first, then if you feel comfortable, you can automatically go deeper into that. Okay, so yes, any other question? How can patient manage fatigue and pain while maintaining intimacy and connection with their partner?
Okay, so may
Mm,
I think I want to take this from a different
yeah.
point of view. Actually, I feel that um, the answer to managing fatigue and pain is what by having great connection with your partner. Like that is one tool that you can use in your toolbox in terms of how to manage um, going through treatment. So we did talk about that, and clearly we rather than viewing it from a, oh, I gotta do it like it's a tick box, we need to come to it from okay, I need this support. I do want to share the struggles that I'm going through. And then when you're feeling seen and feeling heard, I think that's where you are able to then feel that maybe that can be uplifted a little bit i- in terms of maintaining that intimacy and connection. So it's more of a flow, I feel,
Mhm.
right? Do you, Malini, in terms of you um seeing your patients, do you have any input into
We always
this?
say the support is very, very important. So when the support is there, definitely they can manage like the side effect and all that. Because many patients they struggle by being alone during their cancer journey. Yes, they do have a family member, but they always like share to say that they don't have that connection, they don't have the communication. Not only with the spouse, sometimes it can be with their own family members. They
For
might have
sure.
so many people under one roof, but they don't feel like the communication is not there. Okay, so when it's come to your spouse, we always find that if the support is there, definitely you will be able to manage things together.
But
uh,
also, right, Malini, I don't feel that it needs to be, just the partner giving the support though. Like clearly there are friends, and as long as you can tap into someone that can make you feel seen and heard, I think that's the key really, because then you will be somewhere positive to be able
Correct.
to
Yeah,
overcome the challenge
I
mentally, right?
totally agree with this because sometimes we always ask the patient, how is their support system? This is one of the question that we always ask them because from the answer we'll be able to know how is their cancer journey is going to be.
All right. Okay.
So we find it the support not only for from their spouse but also from the family, the workplace. It can be their friends, it can be relatives, and so on. But sometimes newly diagnosed they tend not to share the news to many people. But we always say that it's the personal choice. But
Yeah.
if you feel that you are able to just share, you feel you wanted to share with just a few selected people who will be able to be with you, then it's totally fine. And they'll say yes. Because the fear is always there, doctor. The more they try to share with everyone, they find it they need to have this social support. They tend to get a lot of different advisors and
No, I
recommendation.
know. I think, Malini, we have to talk about that. It's important to be selective
Correct,
because
yes.
suddenly you become the target of, uh, you know, different therapies, for example, or advice. Yeah.
Because their mindset is always like the moment they diagnose, their mindset is like what can make me feel better, how I can recover from this cancer diagnosis. So the moment like they listen to people, they'll get confused. So yeah, definitely this will be another topic that we will discuss another time because I find that still in our community, so many experts are there to give free advice. Okay, so Azir Moktazar, I guess like doctor have explained and give you the answer. So anything else? Any other question? Of course, yes. Siranjeevi. So family members, cancer patient will go through mental health issue. Yes, as we always say, caregiver is not only about the spouse; it's always about the family members as well. That's why we always say the caregiver will have their dilemma as well. Okay, and they tend to suppress their feelings and emotion because they wanted to show the different land to say that how strong they are. So the mindset is always say, I need to be strong. I cannot cry in front of my beloved one, otherwise this person will have more low mood and so on. So of course, if yes, how do we overcome it without affecting the patient itself? You will be able to connect with the caregiver support group. If you feel that you wanted to share, you wanted to get the opinion from someone, will be able to connect you with another caregiver. It's very important. Don't feel it like it's wrong for you to seek for professional help. Caregiver, you are most welcome to express and share your feelings to the professional.
But
Okay,
Malini, they are at risk of burnout, right? Like as caregivers,
definitely.
yeah, if they don't
Yeah,
look after themselves. And I think
because
that,
yeah,
yeah, we don't talk about that enough, and we don't give um, I think recognition enough to all our caregivers out there that they're doing tremendous work. And it's like the unsung silent heroes in the journey.
Correct. Because sometimes when we have this session, we always find the patient punya stress level is manageable. They are okay. But sometimes when we look into the caregiver, the moment we ask them, how are you doing? How are you feeling? That is where the silent moment will kicks in, that's where we will be able to understand they are going through something else as well. So the
Right.
depression, the stress, the anxiety is not only for the patient but also equally to the caregivers and
Can
also for
imagine.
the primary care I mean not only for the primary caregiver but also for the family members.
For
So
sure.
the cancer is it will affect the family overall, so
Mm,
it depends on how are they going to manage it together. So that's why the support system is very important.
mhm.
Okay, thank you so much for your question, Siranjeevi. Okay. Hmm. We always counseling is yes, we always encourage the family members and the cancer patient to come and talk to the professional. They might seems to be okay, definitely, they will say that yeah, we are okay, we are fine, but deep inside, they will going through the silent battle because they are not able to share with anyone. Okay, this is where slowly from stress they will get into the depression. Okay, they will
Yeah,
isolate themselves.
I
Yes.
feel that it's not just accessibility that is clearly an issue in Malaysia. Not
Mm,
everyone get access to great counselors like yourself, Malini, or psychologists available, but also there's a barrier, like a mental barrier. I mean, I offer your services, like I have your pamphlets in front of my clinic, and I'm just like, would you like to speak to someone? I feel like, there are people, experts that can help you navigate through this, and usually the answer will be this.
yeah.
Tak
And
apalah dulu.
many will have this question in doctor. The moment they come for counseling, they say, "Is it going to be recorded? Is it like my company will know about it? Will this affect my insurance?" So they will find it like going for therapy is something like a big no. They find it like, am I? Is anyone going to judge me? Is anything going to affect me? So we always say that as much you care for your health, your mental health is important equally. Okay. So in NCSM, like Dr. Nina say, we have the accessible for counseling services. We have accessible for psychotherapy by our clinical psychologists. So please, if you feel that you wanted to speak to someone, we are always here to assist you.
And importantly, it's confidential, right, Malini?
Yeah,
So
confidential.
they
Yes, it is
won't
very
get.
important.
Yeah, yeah, yeah.
So we are the professionals, so we will always keep this PNC thing. So feel free, okay. And as part of treatment, we won't say it is 100% required, but it is important as well because it's a platform for you to share your emotion and feeling, which you don't have to go through this alone.
Fantastic. And then it's free in NCSM.
It is free. It is free.
Exactly. Very important to
If
note
you are
that.
not able, you are undergoing active treatment, you feel that your immune system is low, just give us a call, schedule an appointment, we'll access you through online. From there, we will decide if we are able to come and visit you, we'll definitely can pay a home visit. So it's not necessary for you to come and visit it at our office. So we will find way to come and visit you as well.
Thank you.
Okay, so hope I guess like we already answered all the questions. Anything? So before we end our session, last question, doctor. Sorry, from Zaki about head and neck cancer as NC and PC. How or is there an issue?
So Fifi Zaki asked about head and neck
Yeah.
cancer, and I treat a lot of patients with head and neck cancer. NPC is nasopharyngeal cancer, like what Datuk Lee Chong Wei had. Is there family planning with regards to fertility? Absolutely. This is an important issue. So before we go into chemotherapy, we would counsel our patients if they are in terms of their family. So the first question is, it depends on the age of the patient and how many children they have, or do they have still wish to have they completed the family or not. And then we would, if there is still wish, then we would clearly review that and see how we can get fertility specialists to see them. In Pantai Hospital we do have fertility specialists
Mm.
in the hospital, so we would do a referral for sperm banking, for example, for male patients. If it's a female patient, then we would have to discuss it a bit further in terms of what therapies are available, and you clearly have to think about timing of that, timing of the sperm banking prior to treatment, and we don't want to compromise treatment that much. So there are various issues that we would go into more before embarking on the chemoradiotherapy.
Mm. Okay.
Great question, Fizaki.
Yay. Okay, so let's summarize today's session. Thank you so much, Doctor. Okay, so nice to have you today with us today. And for the audience, think about one small way you can show your love and emotion support today. Okay, so always remember your love story does not end with illness, it involves, threatens, and find new meanings. Okay, so reflect on how you can strengthen your emotional connection with your beloved one today. And any word from Doctor?
No, I think I want to congratulate everyone who's tuned in, and great questions and discussions that we've had. Thanks again, Malini and NCSM, for having me on board.
Thank you so much, Doctor. And thank you, audience, for watching us today. So definitely we'll come with another topic, some other interesting topic for our next webinar. So for now, signing off, Malini,
Bye bye.
Dr. Nina. Bye. Good night, everyone.